On this segment of Reaching Out, we're joined by Kelly Wallace, who is a health department police officer for the New York City Department of Health. Kelly, welcome to Reaching Out.
Thank you for having me.
Thank you for being here. Tell me, Kelly, how many years have you been working for the Department of Health as a health police officer?
As of now, I have about at least 16 years of service.
16 years of service. And tell me, not tell me, because I know, what does a health department police officer do? Where do you work? Where, the location of your work, and what do you do on a daily basis?
Well, right now I'm currently located at 125 Worth Street, which is located at downtown Manhattan in New York City. We pretty much police the agency as far as protecting life, property, enforcing the penal law, and enforcing all health codes within New York City Charter.
Were you working on the day of 9/11? Where were you on that day?
Yes, I was. I was working at one of our satellite locations, which is located in Brooklyn, Fort Greene Health Station. When the towers was going down, we always transported back to 125 Worth Street, which is currently our central office location. And we was there approximately about 6 months. And health department police assist in the triage with the victims and helped out with all the aides of first responders that was located at the World Trade Center.
Now, you also have a health center that's on First Avenue, right across the street from Bellevue Hospital. Did you have to go to that facility also?
Well, I was assigned to Central Office, but we had another unit that was assigned to 455 First Avenue, and they was also aided into the recovery efforts of the tragedy that took place at 9/11.
Okay. Now, after doing all that work for 9/11 victims and on that day of emergency, when you hear the attacks on the public sector workers, the firemen, the police officers, your job title, health department police officer, what do you think? Do you feel thanked after all of that work you did, or do you feel unappreciated?
Well, at times, and with any given unit, the effort that you push out, you never really get a thank you in return. But at times, it's very hard to push forth under the strenuous times that we have now. Sometimes we feel that we have a deaf ear on certain things. Things have been changing, but we would like to be recognized as far as pushing forth more and seeing what the other units can do collectively that pay the price for 9/11.
What is the most exciting day that you had as a health department police officer?
The first day I received my shield.
Tell us what that was like.
Well, at the time, we was in a large room, and we was all expecting a big ceremony and a big balloons and party favors and things like that. But at the time, the captain came in, and he addressed myself and another colleague that's still with the unit. And at that point, upon completion, and he handed us our shields. And the shield that I was given was a shield of a former police officer that I worked with closely, and he retired. And he didn't know, and he actually gave me his shield.
And who was that?
His name was Rodney Holmes.
Rodney Holmes. That must have been a thrill.
Yes, it was.
Okay. So, any memories, anything that you remember that stood out over your career?
Well, basically every day, pretty much when I wear the blue, located at 125 Worth Street, helping the public. I'm really am for the people, and I have a need for the people, not only as a day operation, but off duty as well. I really have a need for the people. I'm heavily involved in ministry, and I look forward in aiding and feeding the flock of the people. So every day I have a delight in helping someone out.
Kelly, I want to thank you for coming on Reaching Out. That's all the time we have for this segment of Reaching Out. Our very special guest was Kelly Wallace, Department of Health Police Officer.
Thank you.
Thank you.
Thank you for having me.
Okay, thank you for coming.